My name is Kevin Riché. I'm an orthopedic surgeon in Baton Rouge, Louisiana at Baton Rouge Orthopedic Clinic. Today we're here to talk about pain and problems that you might be having in your SI joint and what type of treatment options there are available. The sacroiliac joint is basically where the tailbone, which is the bottom of the spine, meets the pelvis and where those two come into contact and where the forces from the legs join into the core of the body. Sacroiliac joint pain can mimic other types of pain, and that's why it's not always the first thing somebody thought of. First doctor you see doesn't always come up with SI joint pain because it mimics a lot of other pain. It can look a lot like low back pain, and it can look like nerve pinch pain that radiates down the legs. And so many times I see it. Sometimes it's more like hip pain, so it can mimic multiple things. SI joint pain can be caused by multiple things, but ultimately you can get wear and tear like arthritis type of pain in the sacroiliac joint. You can also get pain from injury to ligaments that help stabilize the sacroiliac joint. I see a lot of different types of complaints from patients that have sacroiliac joint pain. Some of them have pain with sitting. Some of them have a lot of pain when going from sitting to standing or going from standing to sitting. A lot of patients have pain they can't lay on one side or the other at night. And a lot of patients have pain that really mimics low back pain. Pain that goes down into the legs, even numbness, can be caused by sacroiliac joint dysfunction. There's different things that we can do to look for it. The one that's most notable in my office or in my hands is called the Fortin finger test, which is basically where we just push on the back of the pelvis where the SI joint is. That happens to be, in my opinion, maybe the best test, even though it seems very simple. We have a slew of other tests. These are all different maneuvers that we do in the clinic with the patient to try to elicit SI joint pain. So when treating the sacroiliac joint, I start conservatively as often as I can, and I start with things like anti-inflammatory medications by mouth or something like that. And then from there, physical therapy can be very effective for SI joint pain. There's even like a belt or some kind of stabilization belt that you can put on a patient that can help with the SI joint and their pain. And then also sacroiliac joint injections can be very effective in treating SI joint pain. And ultimately, there's always surgery at the end of that if none of those are working. I recommend surgery to patients that are unhappy with everything else. We've tried everything non-surgical and it's not working. And especially if that patient had, in my opinion, a really good result with the injection. What I mean by that, so we administer the numbing medicine, they get, let's say, 100% relief, 90% relief, 80% relief. I think that's a good person to consider the surgery in if, unfortunately, they don't get long-term relief. As far as surgery is concerned, when it comes to the sacroiliac joint, the surgery that I recommend and the surgery that I do in my hands is a minimally invasive sacroiliac joint fusion. We make a tiny incision about that big, and I go in through that incision. I use something for my implants that's made by a company called SI Bone, and I use their iFuse implants, and ultimately that's the system I use. And I'm able, through minimally invasive techniques with X-ray, to put the devices across the SI joint. And the device I'm talking about is a triangular shaped device that's made out of titanium. It's got a porous coating, so it's kind of rough when you look at it. The surgical procedure is small. The going home the same day is easy. The pain is not that bad for most patients, but the more difficult task is having them use a walker or crutches or something to stay off of that leg. So if you're experiencing some pain or symptoms that seem maybe similar to what we are talking about today and you'd like to be seen and be evaluated, please give our office a call and we'd be happy to get you scheduled.